Once again, welcome back to our channel. This time I'm going to be dealing with the anatomy of the mandible. Mandible or the lower jaw is the largest and strongest bone of the face, and it develops from the first pharyngeal arch. The mandible has a body, a ramus, and two processes. They are cornoid and condyloid processes. The body has an outer surface and an inner surface. The outer surface contains symphysis mentae. The symphysis mentae is the line at which the right and left halves of the bone meet each other. It is marked by a faint ridge at the midline area of the mandible. The next is the mental protuberance. It is a projecting median triangular area in the lower part of the midline, and the inferior-lateral angles of the mental protuberance is called mental tubercles. The next is the mental foramen that lies below the interval between the premolar teeth. Then the incisive fossa. Incisive fossa is a depression that lies just below the incisor teeth. Then the oblique line. It is the continuation of the sharp anterior border of the ramus of the mandible. It runs downwards and forwards towards the mental tubercle. The inner surface. The mylohyoid line. It is a prominent ridge that runs obliquely downwards and forwards from below the third molar tooth to the median area below the genial tubercles. The number 5 denote the mylohyoid line in the figure. The submandibular fossa. Below the mylohyoid line, the surface is slightly hollowed out to form the submandibular fossa, which lodges the submandibular salivary gland. It is marked by number 7 in the figure. The sublingual fossa. Above the mylohyoid line, there is the sublingual fossa in which the sublingual gland lies. The genial tubercles. The posterior surface of the symphysis mentae is marked by 4 small elevations called the superior and inferior genial tubercles. The ramus. It is quadrilateral in shape. It has two surfaces, lateral and medial surface, and 4 borders. They are upper, lower, anterior, and posterior borders. Medial surface. Mandibular foramen. The mandibular foramen lies a little above the center of ramus at the level of occlusal surface of the teeth. The mandibular foramen leads into the mandibular canal, which descends into the body of the mandible and opens at the mental foramen. Lingula. The anterior margin of the mandibular foramen is marked by a sharp tongue-shaped projection called lingula. The lingula is directed towards the head or condyloid process of the mandible. Mylohyoid groove. The mylohyoid groove begins just below the mandibular foramen and runs downwards and forwards to be gradually lost over the submandibular fossa. Muscle attachments and relations of the mandible. First of all, origin. Buccinator muscle. The oblique line on the lateral side of the body gives origin to the buccinator muscle. Mentalis and Orbicularis oris muscle. The incisive fossa gives origin to the mentalis and mental slips of Orbicularis oris. Mylohyoid muscle. The mylohyoid line gives origin to the mylohyoid muscle. The superior constrictor muscle of the pharynx arises from an area above the posterior end of the mylohyoid line. Genioglossus and geniohyoid. The upper genial tubercles give origin to the genioglossus and the lower tubercle to geniohyoid. Anterior belly of digastric muscle arises from the digastric fossa. Next, insertion. The platysma muscle is inserted into the lower border of the mandible. Masseter muscle. Whole of the lateral surface of ramus except the posterior superior part provides insertion to the masseter muscle. Medial pterygoid muscle. The medial pterygoid muscle is inserted on the medial surface of the ramus, on the roughened area below and behind the mylohyoid groove. Temporalis muscle. The temporalis is inserted into the apex and medial surface of the coronoid process. The insertion extends downwards on the anterior border of the ramus. Lateral pterygoid muscle. The lateral pterygoid muscle is inserted into the pterygoid fovea on the anterior aspect of the neck. Attachments of the mandible. Pterygomandibular raphe. It is attached immediately behind the third molar tooth in continuation with the origin of superior constrictor. Deep cervical fascia. Deep cervical fascia or investing layer is attached to the whole length of the lower border of the mandible. Sphenomandibular ligament. It is attached to the lingula of the mandible. Foramina and structures passing. Mental foramen transmits the mental nerve and vessels. The mandibular foramen. The inferior alveolar nerve and vessels enter the mandibular canal through the mandibular foramen and runs forward within the canal. Mylohyoid groove. The mylohyoid nerve and vessels lie in the mylohyoid groove. The lingual nerve is related to the medial surface of the ramus in front of the mylohyoid groove. Mandibular notch. The mesenteric nerve and vessels pass through the mandibular notch. The facial artery is palpable on the lower border of mandible at antero-inferior angle of masseter.